I would like to talk about coronavirus disease. Now, it's actually referred to as the novel COVID-19 pandemic. The reason why it is pandemic is because it's worldwide. It has spread all over the world. And it is important for us to know that coronavirus, it actually belongs to a group of viruses that includes SARS, which is a very notorious disease that affects the respiratory system. It also includes the Middle East respiratory syndrome. It also includes a common cold. So it's a group of viruses that most of the time are found in animals, but it can actually jump from animals to human beings. And this is exactly what we suspect happened about coronavirus. Now, the reason why it's also novel is because it's a new disease. It's original. It's there. We've never had this disease before. And so we are still struggling with many things to do with how do we contain it, how do we stop it, and how do we treat it. I know people asking many questions about, is there medication? Is there treatment? Is it true that the measures that have been put in place to control the virus, do they work? I want to answer those questions in a few minutes, and I hope it will be useful. Now, coronavirus actually affects the respiratory system. It is spread through droplets, and that is when somebody coughs, sneezes, or talks. There is a lot of droplets that spread in the air. And as they spread, if somebody is near, they can actually get to their respiratory system. That is through the nose, the mouth, the eyes. And once these droplets land into somebody's eyes or nose or mouth, then they begin to cause an infection. Yes, talking can cause someone to spread that virus through the droplets in the saliva. Sneezing as well. Why is it that close contact is important? Because the air circulation has ability to sweep away droplets. But when you're very near, it can easily get into your nostrils and begin to spread. I want to mention a few things about how this disease is spread. One, there must be somebody who is infected, then they cough or they sneeze, and the droplets will spread actually over about 1 meter or so. So that close contact will be very important for someone to get the disease. If you are far from them, it is easier for the droplets to be swept away and you'll never get to them. Why is it important to wear a mask? Like I have one here. Yes, because the mask will prevent the droplets from getting to the mucous membrane of the nostrils, in the mouth, and in the eyes. When you protect yourself with a mask, the person who is coughing, the droplets do not spread. And at the same time, the person who is not infected does not get into contact with those droplets. Why is it also very important to ensure that you don't touch your eyes, your nostrils, and your mouth without washing your hands? It's because If those droplets were in my hands or my fingers, and I touch my eyes and my mouth and my eyes, then I'll spread those viruses into my mucous membrane, which is very essential for the transmission, and then they will ascend to the respiratory system and cause a serious respiratory problems like difficulties in breathing. Now, from the medical point of view, how do we diagnose, or do we say somebody? And the government has already put forward a diagnostic way, or how we should be able to identify the person who is suspicious of having the virus or who could be infected. One, they must have these symptoms: coughing, sneezing. Sometimes they could have loss of taste and smell, and sometimes they may have fever. And I'm saying sometimes because all this may not occur at once or at the same time. It is important for you to know you could have just one symptom and actually progress, because high fevers, like temperatures of 38 degrees, that's 7.8 degrees Celsius, could tell you you could be having the viral infection. But what is the best move from that? You should actually be tested. You should take yourself to hospital, be tested, and make sure you don't spread the virus to other people. So you stay away from other people, what we call quarantine. You quarantine yourself, or self-quarantine, meaning that you isolate yourself away from your family members, from your friends, so that you do not spread the disease to them. Now, I want to just mention about treatment, because the question many people have now is there treatment? I would say we are far yet to identify the true treatment or the exact treatment for COVID-19. Afigan is one of the antiretrovirals that has been developed. And this Afigan, of course, we are not yet sure that it will be able to eliminate and give us good results. In the US, people are using what we call hydroxychloroquine. This is an antimalarial. Of course, it has shown some effects in treating the disease, but really, we can't say it is a drug of choice. There are some other antiretrovirals that have been tried, but it's not true that they were meant for this particular disease. Yes, they have been tried on patients who have HIV, but we can't tell for sure that it's actually a treatment for COVID-19. Vaccines. Many countries are trying to develop the vaccine. We are still in the trial stage. Let me mention something about vaccines and drugs. Once a drug is manufactured for a particular disease, it cannot be used unless it has been tried and proved that the side effects or the adverse effects will not destroy the lives of people more than the disease itself. And that's why the trial period, we suspect within 2 to 4 months or so, we are likely to come up with something. But what is the way forward? It is very important we comply with simple rules. Isolate yourself, wear a mask in the open places, when you go shopping. There is a very simple message: stay where it is safe, and home is always more safe. And that's why you've heard people, the government saying, stay at home. The other very important is keep a distance from one another. Do not get into contact. Some cultures and way of life, is very detrimental to COVID-19. Hugging, kissing, and being so close to somebody who could be infected. I urge you to remember, it is just a simple compliance that can save your life. And so I would stop there and say, medications are not yet found, vaccines are not yet found for this disease. The only way we can do, if you're sick, is to support you to get better. Maybe support your respiratory. Make sure your temperatures are low. Enable you to breathe better. Give you oxygen. And that is the much we can. And then we allow your body immunity to get rid of the virus. And that's why we're saying prevention in this case is much better than the cure. So I would say stay safe and avoid places where you could get into contact with somebody who is infected. Thank you.